Good afternoon. On behalf of the PDG B5TA Center, we hope that you've enjoyed the convening this week. We hope that it's provided an opportunity for you to learn from your peers and other national experts. This afternoon, we're fortunate to wrap up the convening by hearing first from a federal panel, as well as from our keynote today, Dr. Dipesh Navsaria. Shannon Christian will be moderating our federal panel today. She serves as the Director of the Office of Child Care. Thanks for joining us today, Shannon. I'll pass it over to you.
Hello, PDG, Birth to 5 stakeholders. I want to thank you for recognizing and embracing the opportunity that PDG Birth to 5 presents to think creatively and collaboratively, and for being excited about the possibilities of what we can do when we work together. We've had so much fun administering this program, and that is because of you. I've been hearing rave reviews of the really meaningful, innovative progress by the states and territories, and that exciting projects are spreading to other states, and I can't wait for my briefing. Meanwhile, we thought it might be helpful to briefly share a few existing, exciting initiatives and projects that are happening at the federal level that might support your work going forward, including areas where federal staff and leadership are wrestling with some of the same challenges you face, and may be able to contribute in ways that bring new perspectives, resources, research, alignment, and partners to the table. So first, I'm just going to quickly introduce the panel, and then during the run of show, we're just going to pass to each other. So first speaking will be Jamila Smith, our PDG Birth to 5 administrative partner from the Department of Education, Office of Elementary and Secondary Education. Jamila, we agreed we'd wave. Okay. Michael Warren is next. He's from HRSA and head of the Maternal and Child Health Bureau. Michael shares our interest in systems that work for children and families. He's a pediatrician with background in public health and psychology and a really good partner. After that, we'll hear from Jennifer Brzezinski, whose name I can never say, from HHS, the Secretary's office. Really, they have a staff office called the Office of the Assistant Secretary for Planning and Evaluation. She's the Associate Deputy Assistant Secretary for Human Services Policy, and she oversees a broad range of research that includes working towards shared outcomes across human service programs. Next, me, I have a couple of ideas. I head up the block grant for CCDF, and then we also, share administrative oversight of PDG Birth to 5. And then last is Jerry Milner, who heads up ACF's Children's Bureau. He's behind ACF's passionate effort to shift focus to primary prevention in child welfare and family well-being. So I think you got a nice mix here. And Jerry is last, I'll tell you now, because I hate to follow Jerry. And this one time, I got to set the agenda. So I am second to last, and you are last, because he's a hard act to follow, and I'm tired of it. So we have about 5 minutes each. And so this panel is just an introduction. Your federal project officers and TA specialists are committed to following up with you either through the regular topical webinars or the communities of practice. So at this point, I'm going to turn it over to Jamila.
Great, thanks, Shannon. Let me know, can you all hear me okay? Good, okay, awesome. Well, I definitely first want to acknowledge, before I sort of launch into a few of my points, the remarkable effort that I think everyone in the sort of early learning space, Shannon and her team has done and sort of rising to the challenges that we faced this year. So definitely wanted to acknowledge that. Shannon, you and your team have been an amazing partner. So just wanted to say thank you for that partnership. But we, of course, know that our earliest learners are working in a learning environment that is far from optimal. Every day their families and their caregivers are, working to rise to the same challenges that we're all facing to make the most of this current situation. And I think it's, this dedication that reminds me how important our work is to our nation and just ensuring that our younger generation is prepared no matter what challenges we're facing. So I'm really happy to share a few things that are happening within the Department of Education that may be of assistance in your work. In terms of the Department of Education has a COVID-19 resources page for children and families that includes sort of a curation of learning at home resources from various federal agencies. It includes information such as the Kennedy Center, the lunch doodles they have with Mo Williams, who we all know, has those famous pigeon books. They also offer sort of, virtual tours through the Smithsonian, since we aren't able to be there in person, and has various links to NASA and STEM kits for kids for all ages, things that parents can do sort of at home while you're thinking about like trying to provide those virtual supports. And I can post at some point, since I'm done with my comments, all of these links in the chat if it's helpful. In the vein of interactive learning and thinking about how do we engage with our community in a virtual or socially distant manner, the Department of Education annually hosts what we call the Games Expo to help showcase early learning games, apps, and other technologies that are developed through U.S. Department of Education funded grant programs. One of which is the Ready to Learn program, which is within my office, but it offers just really cool and interesting games and apps for kids of all ages, but really geared toward those sort of early learners and helping them to access education and materials anywhere, whether it be in the back of seat of their parents' cars, with the grocery store, or even in their living room, which I'm sure they're tired of seeing at this point, but just offering kids as much as we can during this time. Also, in terms of speaking directly to our PDG directors, I would encourage you all to use this time to continue to seek opportunities to just align and deepen your state's early learning continuum work and finding ways of leveraging other federal funds to support those efforts. Of course, Title I Part A still remains available to help expand those preschool program slots and could be an opportunity to leverage and expand the programs. Title II Part A, while it's focused on teacher professional development and enhancing and building the capacity of our educators, it can go to support early learning teachers, elementary schools, early child care educators. So I would encourage you to sort of look to those programs or look to those federal directors who are managing those programs to find opportunities for connection between the PDG grants and those funds. Also thinking about Title III Part A, which is intended to support our English learners, finding ways to leverage, professional development supports for preschool teachers or school leaders who are working with our English learners. I would be remiss if I didn't mention IDEA Parts B and C, and thinking about how do we provide supports for our nation's infants, toddlers, and children with either intellectual or physical disabilities or delays. We have a variety of community and parent resource centers that are funded through our partners in the Office of Special Education Programs that offers, they're in every state, DC, Puerto Rico, and the US Virgin Islands. So these parent centers are offering webinars, tutorials, materials, kits that you can download or request from the department be mailed to you that families can use at home, educators can use at home. And these are free resources and materials. So I would encourage you all to also take a look at that. And I could be sure to put that in the chat. Just wrapping up because I now only have 5 minutes. Thinking about in our Institutes of Education Sciences, there is an early learning network that seeks to help improve access to pre-K, high quality pre-K, thinking about identifying research proven policies and practices that go to help narrow the achievement gap and maintain early learning success. And there's a number of really rich and interesting assessments and longitudinal studies taking place across diverse settings. And I would encourage you to sort of peruse that information regarding ongoing studies and any policy briefs that might be of interest. And I think lastly, we have what we call regional education labs that are responsible for providing technical assistance to our regional partners across the nation. And the Southwest Center recently hosted a webinar entitled Supporting Families in Promoting Early Learning at Home. And I think sort of from participating in the webinar, there was another host of rich resources and materials that I think would be of value. So I want to thank you all for attending this meeting, your continued perseverance and partnership with us. And I look forward to continuing our partnership in the new year. At this time, I'm going to go ahead and pass the floor over to my colleague, Michael Warren, to share some interesting and great information with us. Michael?
Thank you, Jamila. Good afternoon. I'm pleased to be joining you all from HRSA's Maternal and Child Health Bureau. In MCHB believes in the importance of aligning and coordinating maternal and early childhood health and early learning systems so that when we work together, we can realize a vision of all children being healthy and ready to learn. We know that too often those systems are siloed. That's not how families live, and they're counting and depending on us to be able to work together to best support them. We are also strongly committed to health equity, and it is well established that accessible early connection to quality early learning and care is a cornerstone of health equity. So we're proudly partnering with early childhood agency partners, including our colleagues at ACF, to move forward toward greater collaboration. We know there's opportunity for us to do that at the federal level. And we're particularly excited about some work we're doing right now where we've gained some momentum in thinking together about coordinating TA, needs assessments, and program outcomes, which we hope is going to smooth the path for you all at the state and program levels down the road. I want to share a little bit about our investments in early childhood. You probably know we invest strongly in this area, both within our really broad maternal and child health block grant, or Title V, but also in some very specific programs like McV, the Maternal, Infant, and Early Childhood Home Visiting Program, which provides voluntary evidence-based home visiting to 50 states, DC, 5 territories, and tribal entities. We also support a growing early childhood systems portfolio, and our aims there are to strengthen, align, and sustain multi-generational systems at the state and community level with a focus on prenatal to 3. I know you all are at different places in terms of your partnerships with Title V and McV and ECCS. One concrete opportunity I would put forward with you is to reflect on where you are with those partnerships and to consider if there are opportunities for strengthening those connections. One of those opportunities for partnerships may be around needs assessments. So in 2020, both McV and Title V needs assessments were due, and these provide awardees with a unique opportunity to leverage and align key activities with those needs assessments. And it actually created an opportunity to coordinate and collaborate with other state and local partners who have been engaged in complementary needs assessments, including your efforts through PDG Birth to 5. With the McV law, it actually requires that McV awardees develop their needs assessments in collaboration with those that are conducted under Title V, Head Start, and CAPTA. So both to model and support that collaboration, MCHB worked closely with federal counterparts to plan, coordinate, and share opportunities for coordination and lessons learned. I want to also announce to you something very exciting. This just released today. In fact, we were going back and forth on our talking points because we weren't sure if it was going to be announced today or not. But we've released a new funding opportunity for the next iteration of the Early Childhood Comprehensive Systems Program, or ECCS, and this focuses on health integration for prenatal to 3. We will fund up to 20 awards, up to $250,000 annually for each of those, and a number of the areas overlap with PDG Birth to 5, including moving upstream, increasing our focus on equity, family and community engagement, health systems integration with other parts of the maternal and early childhood systems, and leadership to align efforts and improve partnerships. The folks who get these ECCS grants will be doing a comprehensive asset and gap analysis to current maternal and early childhood systems of care, focusing on that prenatal to 3 period as part of their award. This includes a specific expectation they build upon and coordinate with existing state level needs assessments like your PDG Birth to 5. So please be on the lookout for those opportunities. Lastly, in my last minute, I want to share with you, next week we'll be officially launching our P4 Challenge, Promoting Pediatric Primary Prevention. We have $1 million prize purse that we will be making available, and this is specifically in response to the COVID-19 pandemic to increase immunizations and well child checks. We know from our colleagues at CDC that those have declined during the pandemic. This is a great opportunity to unleash innovation and think about community partners, specifically in the early childhood space. So even though I'm from the South, I tried to talk really fast and get all that in 5 minutes. And with that, I'm going to hand it off to my colleague, Jennifer.
Thanks a lot, Michael. It is a pleasure to be here with all of you today. And I want to start out by recognizing really the hard work and leadership of everyone on this call and those of you who are participating in the conference. We are certainly inspired in my office every day by all that you do to really build an early childhood system that's centered around children and families. And I know this has been even more difficult this year given the really significant challenges of the pandemic. So thank you. You are really leading the way on kind of reducing silos across federal programs and keeping the focus with people. And so we are working hard to keep up on our end as well. My office, as Shannon mentioned, in the Office of the Secretary, is also really committed to federal cross-agency work to better align programs, both to reduce administrative burden on practitioners and those that you serve, and to achieve better outcomes for children and families. We work really closely with many of the offices here, early childhood programs across HHS and other federal agencies, and we conduct research and policy analyses to support these efforts. So this afternoon, I just wanted to share a few examples that I hope will be of interest and use to you. I'm excited that we have a new project to develop tools to assist states and localities in coordinating all these multiple federal funding streams with the goal of increasing the supply of quality early care and education and really increasing access to comprehensive services for young children and their families. We were again, really pleased to see at this conference, the finance and sustainability were part of the convening, and we will be working with the PDG Birth to 5 TA project to coordinate our collective efforts. Very importantly, gathering input from all of you about how we can make that tool most helpful and most usable. We also, in our office, recently completed a project to kind of help advance our collective understanding of trauma-informed approaches, particularly those when people are working across sectors and at the system level. And we particularly know and have heard from you all that this is an even greater area of concern given the adversity that children, families, and communities are now facing with COVID-19. So the work we did, I think, really highlights the need to reach a common understanding of what it means to be trauma-informed, really focusing on shared strengths-based language and terminology, how we can best support a trauma-informed workforce, and also thinking about how we can strengthen measurement and build evidence on the impacts of collaborating with systems partners and using logic models in this area. Our early childhood team has also been co-leading work with many of the federal partners on this call to examine that needs assessment, again, that's required by different early childhood programs, and also kind of the outcomes, the indicators, the performance measures that are used, all different ones I know, that are used by federal initiatives and programs that support young children and families. And our focus really is to try to better align requirements and identify opportunities, again, for partnership and collaboration. And finally, I have a great data team that often conducts kind of quick analyses on critical issues for the field. So just a few examples of their work. We have been tracking employment in childcare through the pandemic and recently issued findings that as of October, employment in childcare services has gone back up to 83% of where it was in February. So still not near where it was in February, but getting much closer than what we had seen in earlier months. We also have regularly conducted analyses of who is eligible for child care subsidies and who gets it. We release those briefs every year. Our most recent analysis for fiscal year 2017 found that it's only 14% of children who are eligible for those services actually receive a subsidy. So I think we generally get folks really interested in that because when we think about programs working together, I think it's pretty clear that overlap and redundancy of services is certainly not our biggest challenge there. And finally, we have done a lot to look at kind of the changing cost of childcare, and we have a brief series on that. So we will follow up to provide links to these resources. I want to thank you again and wish you all a safe and healthy holiday season. And I'm now going to turn it to Shannon. Thank you.
Thanks, Jennifer. I just want to talk about how the Child Care and Development Fund, our block grant subsidy and quality investment program, can be used to take investments in children's health and well-being to a new level. As you all know, the COVID-19 pandemic has swiftly and substantially affected the social emotional health of children, especially those experiencing multiple hardships. And as the pandemic has spread across the United States, many children are experiencing widespread disruptions in daily life. Young children are reacting to stress as their parents and caregiver routines change, and the children may have strong feelings of fear, worry, sadness, anger about the pandemic and related issues that affect their behavior at home and at childcare. So with the added money that's being discussed in Congress as part of a stimulus package, we believe we have a chance to promote social emotional wellness, both as an important quality component of childcare, but also as a response and recovery to the pandemic. And I want to say a little more about that. I know you've had in your conference a strand that's centered around taking a comprehensive approach to behavioral and social emotional health. So I'm assuming you know why this is important, and I'll just get to the point of the opportunity I want to share. For a long time, the capacity for childcare to support children's healthy social and emotional development has been recognized as an element of high quality. But the degree to which teachers and caregivers are trained in and supported to do this work varies tremendously across states and childcare settings. And many childcare providers have little to no training at all, much less training in social emotional learning. And despite good intentions, the reality is competition for limited funding across so many unmet childcare and other early childhood needs has left training and supports for this critical social emotional work behind. So with the pandemic's impact on child and family well-being, as well as childcare businesses and the overall economy, we're likely to see additional stimulus dollars for childcare that can support increased investment in social emotional well-being. And we all need to get up to speed on what's possible. So the Office of Child Care is a new initiative to improve social emotional wellness of children, embedding it into childcare, that kicks off December 15th, next week. It's our first step. This webinar will highlight potential strategies, partnerships, funding sources, and implementation examples that have historically not been easily accessible to those in childcare. Some of the topics include things that you've mentioned already on the other speakers: trauma responsive care strategies, relationship-based care for infants and toddlers, descriptions of the pyramid model for supporting social emotional competence in infants and young children, and infant early childhood mental health consultation. In addition, we're going to talk about the benefits of combining these various efforts to implement a more robust social emotional well-being effort. And then there's going to be information on how to access free technical assistance, a resource kit that we'll keep adding to. And then a last minute piece about how CCDF funding can be used to support social emotional wellness. Now, those of you who have your CCDF administrator at the PDG Birth to 5 table and intimately involved in realizing your early childhood vision are in good shape to start discussing the prospect of new funding and support for social emotional capacity building in childcare. But for those of you who haven't yet embraced and engaged your CCDF administrator, this might be just the time. Note that any money that we get for childcare as part of the stimulus won't be earmarked for social emotional development and capacity building. So whether a state's interested in taking pyramid training to scale or building a network of infant and early childhood mental health consultants, doing both, or taking another approach, the CCDF grantees will need to weigh the options and choose to invest in this. And we're committed to making the case and offering the technical assistance and help and support to make this happen. So I want you to stay in touch with your CCDF administrators. They're our primary audience for this work. And the money could be significant, but as I said before, there's competition for how that money would get spent. I mean, the expectations are that money will support not only the subsidized children to stay in childcare, it'll help support emergency workers who are still needing childcare settings for their children. Some of this is being offered without any copay on the part of those essential workers. And then there's a big interest from Congress in supporting the whole childcare market, something that the CCDF program has never done. So instead of just thinking about the subsidized children and their providers, which can be a mix of subsidized and unsubsidized kids, the idea is to think about what are we going to have to do to get this money out to all kinds of childcare providers, private sector, the whole mess, home-based and center-based, so that they don't go broke and they're still there when the economy recovers and people need to go back to work. So there have been numbers as high as $50 billion being kicked around, and now it looks more like it's going to be 10 right now, and then maybe we'll get another shot at it. But either way, there is enough to spend some of it, if people want to, on the social emotional development goal. And it's a kind of a once in a lifetime opportunity to scale up and train. And then hopefully the regular CCDF money that goes on every year, that the quality dollars that are in there that are flexible can keep it going. But this initial push to build the infrastructure, train people, get it going, could be done with the COVID money. And so that's our vision. And we want you to help us make it work. We want to be there for you. We want you to partner with the CCDF team. So now I'm going to turn it over to Jerry, who's last, not just because of what I said before about being a hard act to follow, but because he's really the man of vision, and I wanted to let him be the final speaker. So Jerry, your turn.
You're incredibly kind, Shannon. Thank you so much. And thanks to all of our other panelists for all of the incredible work that you're doing on behalf of children and families across our country. It is the most important work that we could be doing right now. For those of you who may not know, the Children's Bureau here within the administration on children and families is responsible for administering the federal programs with regard to child abuse and neglect, foster care, adoption, many of the support and prevention services that we're able to provide through federal funding and guidance across the country. Our child welfare system traditionally has been a system that is quite reactive in the sense that we usually engage with families and with children after something bad has happened to them. After, most often, we get a call to our child abuse and neglect hotline saying that a child has been harmed out there. Our role at that point very often becomes a role of trying to fix trauma that's already occurred. Over the past almost 4 years now, from the Children's Bureau and from the viewpoint of our critical partners out there, we have been working to change that whole paradigm from a very reactive system to a very proactive system where we're able to meet families, young people, children, where they are and provide critical supports before a call to a child abuse and neglect hotline is actually needed. We believe that if we invest in families and we invest our dollars in prevention, it's a win-win situation for our communities and all of our families, and indeed for our country. Our vision that we have been aggressively pursuing for these almost 4 years is really targeted to child and family well-being, as you've heard so many of our previous panelists here mention up to this point. The vision is really for a system that supports young people, children, and parents before more intensive interventions, often clinical interventions, are actually needed, while at the same time addressing those needs of children and young people who absolutely must be served in more intensive ways, primarily through our foster care system, so that we have the capacity to reunite them with their families quickly when that's possible, or to provide other forms of permanency for them so that they have those lasting connections that all of us need throughout our lifetime. Our vision really is about helping families not just to survive, but to thrive. It's important to me to mention to all of you that the voices of those young people and their parents who have been served through our child welfare system have been absolutely essential in helping to shape this vision here. We have made a point and will always continue to make aggressive efforts to listen to those people who have lived experience, which we call lived expertise in our child welfare system, so that we can understand how we can best garner our resources, make decisions, and implement initiatives out there that can best meet their needs and break some of the very difficult and harmful intergenerational cycles of difficulty and disruption that so many of our families experience over the course of generations. We've been incredibly excited about pursuing this vision, and within the last few months, we've taken very concrete steps to go beyond the vision itself and into implementation of this vision. We have launched recently a piece of work. We don't want to call it a project. We don't want to call it an initiative, really a movement, a change in direction for child and family well-being that we're calling Thriving Families, Safer Children, a national commitment to well-being. We have identified sites across the country that have already begun in 4 situations to implement this vision in collaboration with communities, in collaboration with other child and family serving organizations and agencies, and particularly in collaboration with the families who receive the services of our system. We know that this is a radical transformation of what our child welfare system has traditionally been in this country. But we believe it's that kind of radical transformation that's absolutely needed if we're going to change the experiences that our children and our families have through their involvement with us. We also know that this kind of transformation cannot be a child welfare transformation in and of itself. Many of us touch the lives of the same children and families. Many other federal, state, and local agencies do that. The philanthropic community, the advocacy community, the courts, the legal and judicial system. All of us have a role to play in helping to ensure the well-being of all of our children and families. And we have formed partnerships with many of these entities to get this vision off the ground and working on behalf of our children and families in our country. Very specifically, we have partnered with Casey Family Programs, Prevent Child Abuse America, and the Annie E. Casey Foundation to come together around this shared vision. We've also come together over the last couple of years with other federal partners, including HRSA, which Dr. Warren is representing on the call today, but others, including Children's Medical Services, SAMHSA, the Centers for Disease Control, HUD, as well as our own organizations within the administration on children and families. We're very excited about this opportunity. We believe that there's incredible momentum right now across the country to support and strengthen families before their circumstances become so dire that the opportunities to help them overcome those obstacles become quite diminished. Just in deference to the current pandemic that we're experiencing, I will say that the COVID crisis out there, as all of you are incredibly aware, has done a couple of things. One, it has created more difficulties for our families, but in child welfare, it's probably done more in terms of shedding light on gaps in our system that have already existed out there. And if that is the case, and if it is heightening our awareness and our sense of urgency to move forward, then that perhaps is a part of a silver lining of an otherwise very, very challenging and difficult situation out there. We're thrilled to be a part of this. We're thrilled at the promise that this offers, not just for us as a system, but for the lives of our children and our families. And we hope that you'll follow our work and our progress, and where possible, be a part of that and support these efforts to help our families our children, our young people, indeed, not just survive, as I mentioned, but to thrive. So thank you very much. Now that you've heard from the members of our federal team, I'm going to send things back to Missy, who will now introduce our keynote speaker. Thank you very much.
Thank you all for sharing that federal perspective and for the great resources that you've been able to make sure we're all aware of and the opportunities that are also coming up. It's great that you all have been able to kind of work together across federal program offices the same way that many of our PDGB-5 grantees are doing at a state level. So it's great to see that. So thank you so much for sharing and for sharing that perspective as a group. I now have the pleasure to introduce Dr. Dipesh Navsaria from the University of Wisconsin, who is a fantastic resource and has been doing a lot of really great work as a medical professional, as a medical professional, as a children's librarianship. He's also has graduate degrees in being a physical assistant in medicine and really brings a unique combination of interests and experiences together. Dr. Navsaria has practiced primary care pediatrics in a variety of settings with a special emphasis in working with underserved populations. Additionally, he's deeply engaged with early literacy programs in healthcare settings, particularly around those of the early brain and child development, which includes neurobiological effects of adversity and poverty on the developing brain. He's going to share a bit about the importance of the first 5 years and encourage and remind us about the reason we all do this work as we continue to develop these mixed delivery systems. Please remember to submit your questions using the live Q&A box to the right of your screen. Thanks for being here today, Dr. Navsaria.
Thank you very much. It's a delight to be here, and I really appreciate this opportunity to spend some time with you this afternoon. I'm going to take a moment here to share my slides and make sure that they are all nicely visible to all of you. All right. So first of all, I'm going to answer the question that many people have when they hear my bio and see all the letters after my name. Yes, I have a lot of student loan debt. Okay, just figured I'd get that out of the way since it's often a question that comes up. And I'm just going to do one more thing here just so I can see everything that's going on here well. Okay. Really, it's a delight, and I look forward to your questions, so please do make sure that you're putting them in as we move along, because I'd like an opportunity to be able to answer those. We always have disclosure slides in the medical world. I have no relevant financial disclosure, not liable to use my presentation, etc., etc. Although I always point out that I'm not sure if the FDA ever formally has approved mouthing as a use of board books. This photo, by the way, is my son, who is now a college freshman, and he's really embarrassed that I show this photo. So, of course, I show it as often as I can. All right, so one of the things that happens when I talk about the work I've done over the years in primary care in talking to children and their families about sharing books together is that I often get a response like this. Oh, that's so nice that you do that. And it's, well, yes, it is a great and nice thing, but I want to move us beyond this idea that it's so nice that I do that kind of thing and really recognize that it's critical. And I want to lay that case out for you, not because I think that you need to be told this or that you don't understand this. And a lot of the things I share with you, you might have already heard, but I want to try to knit them together because one of the challenges we always have in this work is to advocate for the need for the work, the funding for the work, the right resources and the right attention. And hopefully, if nothing else, you can walk away with a new set of tools to be able to do that kind of work. So on our brief voyage together today, we're going to talk about a few things. We're going to talk about the world of the early brain and the science that goes behind it. We're going to talk about what happens when things don't necessarily go as well. We will talk just a bit about solutions with a couple of examples. And then, of course, we will just wrap it up from there. However, as you heard, I do have a degree as a children's librarian, so I think everyone, including adults, deserve a story. So I'm going to read aloud to you from a picture book. This is called The Dot by Peter H Reynolds. He's a Boston-based author and illustrator. And you'll see the pictures from the book appear as I read aloud. Art class was over, but Vashti sat glued to her chair. Her paper was empty. Vashti's teacher leaned over the blank paper. Ah, a polar bear in a snowstorm, she said. Very funny, said Vashti. I just can't draw. Her teacher smiled. Just make a mark and see where it takes you. Vashti grabbed a marker and gave the paper a good, strong jab. There. Her teacher picked up the paper and studied it carefully. She pushed the paper toward Vashti and quietly said, now sign it. Vashti thought for a moment. Well, maybe I can't draw, but I can sign my name. The next week, when Vashti walked into art class, she was surprised to see what was hanging above her teacher's desk. It was the little dot she had drawn. Her dot, all framed in swirly gold. I can make a better dot than that. She opened her never-before-used set of watercolors and set to work. Vashti painted and painted. A red dot, a purple dot, a yellow dot, a blue dot. The blue mixed with the yellow. She discovered she could make a green dot. Vashti kept experimenting, lots of little dots in many colors. If I can make little dots, I can make big dots too. Vashti splashed her colors with a bigger brush on bigger paper to make bigger dots. Vashti even made a dot by not painting a dot. At the school art show a few weeks later, Vashti's many dots made quite a splash. Vashti noticed a little boy gazing up at her. You're a really great artist. I wish I could draw, he said. I bet you can, said Vashti. Me? Oh no, not me. I can't draw a straight line with a ruler. Vashti smiled. She handed the boy a blank sheet of paper. Show me. The boy's pencil shook as he drew his line. Vashti stared at the boy's squiggle, and then she said, please, sign it. So I'll come back to that book a little bit later because there's a reason that I chose it, but let's start by talking a little bit about the world of the early brain. Over 10 years ago, the National Scientific Council on the Developing Child released a report called The Science of Early Childhood Development. What they really did was they said, let's take all the research that's out there and try to put together into some big points that help us drive the advice we give, the programs we set up, and the policies that we enact. And not get caught up on like what one study says and what another study says. That's important, but they said, let's really try to make this clear. And I want to walk us through those things because I think they are so important. And even though this is a 13-year-old report, I got to tell you, everything in it is still absolutely valid and has been only strengthened by what we've learned since. So first, child development is a foundation for community and economic development. Many of us may not be used to talking about kids that way, but the reality is, right, that that infrastructure is not just about highways and bridges and tunnels and airports. It's also about the infrastructure of the brain. And we need to be thinking about investing in kids in that way as the backbone of our society. Brains are built over time. This is a really profound statement, even though it's so short. This means you can't put all your money in just a few years of life, even though we all know that's important. That's why we're here, right? But because we need to support those gains that were made early, later on. There's learning needs throughout our lifetimes. But this also means that if we didn't get it right early on, we have the opportunity to fix it later. It's not as easy, it's not as effective in many ways. It takes a lot more work, but it's not a lost cause. And I don't want people to give up on older kids or on adults because this is idea that, well, we missed some critical period. There's sort of a three-legged stool for thinking about health and developmental trajectories. There's the biomedical stuff we look at all the time. They're important, that's why we look at them. But then we realized it was more than just that it had to do with like the socioeconomic environment that children are in. That a child's zip code matters more than their genetic code to these outcomes has been clear to us for a very long time. And by the way, that's a human-made set of factors, right? It's not an automatic that zip code matters. We can fix that, and we need to change that. But then we recognized there were other elements going on here as well. Who's at home? Who's in their early childhood center? Who's in their neighborhood? And how are those people interacting with those children? And that brought us to the third piece, that the attachment and relationship patterns that children are in matter just as much as the other two. And that brings me to the third point, that there's two things that shape how those neurons in the developing brain wire. You got the blueprints, the genes, but you need experiences to guide which neurons wire to which other neurons for what purpose. Do we want a brain that's wired for love, for learning, for the future? Or do we want a brain that's wired for now, for safety, for self-defense, for fear, right? And you can't have one without the other, right? You need to have them both. So it's like having a campfire. You need to have wood and you need a spark in order to get that flame going. You need them both. Now, we can't influence genes so much. I have no time to talk about epigenetics today, but we can modify experiences. And how do we do that? What are the levers we can pull? Oh, it's the advice we give, the programs we set up, policies that we enact. Those all modify the experiences that children and families have. And then if you said to me, okay, fine, but what's the most important thing? What does the research say we should be focusing on? And this is the key thing, the most important thing that I have to say today. What matters is children's engagement in back and forth, nurturing, responsive relationships with loving caregivers around them, right? What we call serve and return, back and forth. It's like in tennis. You volley the ball to your partner, they volley it back, you're going back and forth, back and forth. This engagement with loving, nurturing adults in their environment is what drives development forward in young children. I want to be really clear about this. It's the only thing that the research shows drives development forward. This means there is no DVD, no toy, no app that is going to do this job on its own. Those things only work well when there's a parent or other loving caregiver around, talking about it with the child, interacting, structuring, scaffolding. And this is important because parents are being bombarded with messages over and over and over again saying, put your child in front of this DVD, give them this toy, put them in front of this app. It's good for their brain. Yeah, no evidence for that in children that are young. And that's really important to recognize. As one of my colleagues says, there is no app to replace your lap. T-shirts available in the lobby. No, I'm kidding, not really. But that's the thing. We need to make sure this message gets out there to parents. I'm going to play a video for you. When I was an undergraduate, I was a research assistant on a large study with many parts that featured in it this face-to-face paradigm. Dr. Tronick, who's director of the Child Development Unit at Children's in Boston, developed this. They'll explain, and you'll see what happens when this interaction goes well, when it goes not so well, and the kind of change that can happen when it's a short-term thing. I'll let him explain.
Babies this young are extremely responsive to the emotions and the reactivity and the social interaction that they get from the world around them. This is something that we started studying 30, 40 years ago, when people didn't think that infants could engage in social interaction. In the still face experiment, what the mother did was she sits down and she's playing with her baby who's about a year of age.
I'm like a girl. Oh.
And she gives a greeting to the baby gives a greeting back to her.
Yeah.
This baby starts pointing at different places in the world, and the mother's trying to engage her and play with her. They're working to coordinate their emotions and their intentions, what they want to do in the world. And that's really what the baby is used to. And then we ask the mother to not respond to the baby. The baby very quickly picks up on this. And then she uses all of her abilities to try and get the mother back. She smiles at the mother. She points because she's used to the mother looking where she points. The baby puts both hands up in front of her and says, "What's happening here?" She makes that screechy sound at the mother, like, come on, why aren't we doing this? Even in this 2 minutes, when they don't get the normal reaction, they react with negative emotions, they turn away, they feel the stress of it. They actually may lose control of their posture because of the stress that they're experiencing.
Okay. I'm here. And what are you doing? Oh, yes. Oh, what a big
So I used to code these as an undergraduate, and the hard part was not seeing interactions like that. That was actually what we expected. The hard part was when the mother would go into a still face and the baby didn't seem to care, right? It just didn't bother them. And, you know, it was fine. Why? Well, because they weren't used to this back and forth interaction, so they didn't feel the loss of it in the same way. Now, I want to be really clear about something. I don't believe for a second that any of the parents in our study, or any parent anywhere really, doesn't love their child, doesn't want the best for them, doesn't care about them, right? That there's no group out there that has, you know, cornered the market on loving their children better than any other group. That much is abundantly clear. The thing is, we think of this back and forth as being automatic or natural or instinctual. And the thing is, it's actually learned behavior. You know, if people did it in your environment, you know how to do it, you know how to feel confident in it. So this is the thing. We do a good job in our society of spanning information gaps. We hand out brochures and we put billboards up and ads on the bus and whatever saying, you know, read, talk, sing, play with your child. Great, wonderful. Guess what? Most people have seen it. Most parents have seen it. They get it. And they actually try to listen. The problem is either something else gets in the way, or you sit down, you start talking to your 6-month-old, and you feel really foolish after a few moments. Am I doing this right? What is my 6-month-old supposed to say? Maybe I'm doing this wrong. Maybe I didn't do so well in school and I just don't feel like I'm the right person to teach my child something. Maybe they're better off in front of this DVD, right? You see how this cycle of self-doubt goes? So we have not just an information gap, we have a skills gap. And that skills gap is what we solve through modeling, through coaching, through reinforcement, through encouragement. And it takes more work, but the payoff is extraordinary. So we really need to be thinking about these different types of gaps and not just simply doing information delivery alone, because that only gets you so far. Okay, the fourth point, you need simple circuits and skills to do more complex ones. Okay, pretty straightforward, but sometimes people wonder why we're putting all this money into what appears to be kids merely playing with each other. Well, as many, including Thierry Breslin, said, play is the work of infancy. This is that child's job. The fifth point is about toxic stress, and I'll define that a little more carefully in a moment, although again, many of you may be fully aware of this. It causes persistent effects on the neuroendocrine system, and it damages developing brain architecture, causing lifelong issues. Now, these are two head CT scans, kind of a cut looking through the head here, of 2 3-year-old kids. The child on the left is a typically developing child. The child on the right is from a Romanian orphanage in the 1980s. These were like large warehouses of kids. They got all their physical needs met, food and, you know, warmth and clothing and all that, but they got very little emotional contact. There was just not a lot of time for the adults to be able to spend any meaningful time with the kids. So this is not physical neglect, this is emotional neglect. You can see that brain on the right is much smaller. It looks shrunken. It doesn't look as dense with neurons as the one on the left. And I'm giving you an extreme contrast here because even without knowing a whole lot about how to read a head CT, you can see that difference right there. Now, we all have a built-in stress response, okay? And this is a good thing because if you're walking along in the woods and suddenly a hungry bear, you know, finds you, you don't want to be sitting there going, gee, I wonder what this thing is, right? You want to be able to fight or run or climb up a tree or scream or freeze and hide, you know, whatever has to happen. That built-in stress response is really good for those circumstances when you encounter a hungry bear. It's not so good when you resort to that over and over and over again because threats keep happening in your environment. You pump out a bunch of different hormones like cortisol and epinephrine. You of course have a neurological response and so on. Now, nowhere do I want to imply that all stress is necessarily a bad thing. There's sort of different ways of thinking about this. You can have small amounts of stress which are positive, right? This is actually how we learn things. This is how we gain new skills. Small amounts of stress are what we need in order to give us just enough incentive that we learn different techniques, different approaches, et cetera, et cetera. Then you can have tolerable stress. These are significant stressors, but they're temporary and they're buffered by supportive relationships. There's that relationships piece again. And then you have toxic stress, which might be the same kind of stress as tolerable, but it's prolonged. It doesn't go away so quickly. And there's few or no protective relationships. And that might actually be the factor, right? Do those relationships that buffer, are they there or are they not? So in a child's life, when you have situations where there's this few and far between supportive relationships and these significant stressors, it causes problems. Okay, examples are like child abuse or parental substance abuse or homelessness. These cause changes in the very biology of young children that we then call toxic stress. Okay, if everything went fine till you were, I don't know, 11 years old, and then suddenly things go bad, even an 11-year-old has some problem-solving abilities and has some ways to figure things out. I'm not saying it's great, right? But I'm saying that an 11-year-old is much more, where everything's been going fine, is far more capable than a 2-year-old, right? Are you going to look at a 2-year-old and say, well, why did you not report the physical abuse that you were undergoing? I mean, that's ridiculous, right? They have no idea how to, you know, dial a phone and call the authorities. I mean, that's not a skill they have. Whereas an 11-year-old might, you know, not saying that all of them would, but they might. So toxic stress is something that accumulates from childhood, from young childhood, before you have these other coping strategies. And here's the cycle that happens, right? You have this childhood stress that happens. It kicks off this bear response, this fight or flight. It becomes chronic. It becomes like the one lever you have to pull to kind of protect yourself. You're pumping out these hormones. These cause some changes into the brain that I won't spend much time on today. But here's what we see in healthcare, in education, in early childhood settings, in social services, and ultimately in the justice setting and so on, is that we see a hyper-responsive stress response. They're not as calm. They can't cope because little things aren't little things. They're signs of potential looming major danger. And if you recognize that a little frown on an adult's face is a lead up to you getting beaten, that little frown on your preschool teacher's face is going to be a, uh-oh, I'm going to get beaten, not a, oh, okay, I did something wrong, oops, sorry, and then you just move on. And you get these weird responses, kids screaming, running down the hall, shutting down completely. And people say, what's wrong with this kid? It's the wrong question, of course. The question should be, what happened to this kid? How does their response actually make sense when you realize the context it's in? Because again, all this feeds to into more childhood stress if we, the grown-ups, don't actually work towards breaking that cycle. So what happens as a result? Most of you are probably aware of the Adverse Childhood Experiences Study, which I'm still astonished how much of the general public does not know about it. For them, I call it the most important study they've probably never heard of. And again, remember, this is a study of adults looking at their childhoods and then mapping it forward to what the outcomes were years later in their adult lives. I want to remind you that this is not a study of poor people, which is often the assumption, right? This is actually a study of the middle class, mostly white, college educated, et cetera, right? So this is not your typical impoverished at-risk population, right, that we like to go on about. This is actually a study of general population. So this applies to a lot of different people, okay? They looked at these different categories of abuse or neglect. This is an incomplete list, but it's what they went with. And appearing on the right here are the prevalence of these in that population. I mean, a quarter said they were physically abused at least once during their childhood. Even the lowest number up there is over 1 in 20. Like, this was shockingly common. They didn't expect this. And this has been repeated over and over in so many different states, nationally, et cetera. We're seeing about the same numbers, give or take, okay? So this is not a fluke. Now, you can't measure, of course, the intensity of abuse. Like, how do you say someone's physical abuse was twice as bad as someone else's, right? It just doesn't work that way. But what they said was, you know, give yourself 1 point for each category of these that you say yes to. And that's what we call an ACE score. And a third said they had none. A quarter said they had at least one. And 1 in 20 said 4 or 5 or 6 for each of those, right? 1 in 20. So these were unexpectedly common, but the effects were also cumulative. Okay, two graphs to show you here. This is your risk of developmental delay in the first 3 years of life. If you had 5, 6, or 7 adverse child experience categories you said yes to, you had somewhere between 75 to nearly 100% risk of being developmentally delayed in the first 3 years of your life. versus a much lower number for 1 to 2. The next slide blew my mind. This is your risk for adult heart disease. Okay, I'm a pediatrician. I don't deal with like coronary artery disease stuff, you know, in terms of heart attacks and MIs and all that. But tripling of those odds years later compared to someone who had none, right? This is a massive risk factor, yet we don't ask about this in healthcare. We don't work to mitigate it in the same way. And this creates extraordinary costs, extraordinary pain, suffering, death, disability, and so on. And I could show you 50 more slides of connections, but you get the point. But the last point they made was if we get it right early on, it's more effective and less costly than trying to address them later on. Now, I want to talk a bit about the reality of now, because we are certainly in an extraordinary time. I mean, in an ideal world, I would be standing in front of you giving this talk, right? And that's not happening. Families are facing challenges, but as you heard one of our guests earlier say, you know, they've been there. They've been there a lot. Now, this is an old screenshot. These are ancient numbers. Please do not squint at them too hard because they are so out of date. But it's to highlight that how many people have been infected by the coronavirus, by the SARS-CoV-2 virus and all. Yet, if you look at this point, months ago, it was right 1 million cases in the US. Look at how many families there are in the US, over 80 million. The economic, social, etc. fallout to families is even greater than those who are facing infection within their family. And this is not to downplay the infection, okay? I'm not trying to set them off against each other. What I'm saying is that this is a vast pandemic that's spreading not just through a virus, but through the effects of what we have to do in order to protect each other from the virus. And so families are really getting hit with this in so many different ways that go beyond just simply the number of positive tests that are out there. And as was said earlier, struggles have always been present, right? It's not that families have magically done perfectly until 2020, but now those things are being laid bare and we're much more aware of them and talking about them. And I think it's important. You know, some of the huge structural issues that we have in, say, how we fund early childhood education, you know, suddenly people are realizing, oh, wait a minute, what does the world look like where we have no early childhood education? Ooh, that's not a world we want, okay? Do we have opportunities there? Well, I hope we do. And the other pandemic, of course, has been the reckoning this year of our nation really talking more, far more than I've seen in a long time, around race and discrimination. And this is a health issue. In 2019, so last calendar year, the American Academy of Pediatrics released this landmark policy statement on the impact of racism on child and adolescent health. If you haven't read it, you need to go read this. It is beautifully done, it is well supported by evidence, and has clear, concrete things around action in there. So please, free download, go find it, AAP Racism Policy Statement, it'll come right up. Because we need to be talking about this, and we need to be doing something about it. We can't keep waiting on this one. Now, if you can forgive me for being a little more literary and artistic for just a few moments, there's a writer, Anatoly Brayard, who famously wrote about his illness, and he talks about how he wishes that his doctor, or really anyone helping, you know, with his condition, would be like Virgil from the Dante's Inferno, right? The trip through hell, the Divine Comedy. And he says, I would like my doctor to be like Virgil, right? Being my guide, pointing out things. We would wrestle with my fate together. And I would argue that for what we do collectively around the well-being of children and families, we're trying to be a bit like Virgil, right? How do we help guide families through this time that's so challenging and so difficult, whether we're doing direct service work or whether we're supporting or training or doing whatever for those who are doing that direct service work? How do we help be that guide through some really challenging times? And I'll just share with you a couple of pieces of artwork. This is some Coke. This is Dante and Virgil. You can see them in the lower right-hand corner of the screen. Virgil's there with the laurel wreath around his head and Dante in the red. And you can see Virgil's hand outstretched there, right? He's pointing out, here's what you're seeing. Let me explain this to you. Let me try to help you make sense of it, because understanding might make it a little easier and give you back some control as to what you're seeing. And this is Delacroix, Dante and Virgil in Hell. And you can see again, Dante there in the red, just, he's losing his balance there, right? He's kind of bent over in this boat or kind of coming to tiptoe over a bit. And you see his arm outstretched and you see the look of horror on his face, right? I think that look is kind of how we've all probably felt at least once, if not more, during this year. What is going on around us? How can this possibly be? But you notice Virgil's right next to him, much more solid looking, kind of giving him some support. He can lean against him. He's got his arm there, kind of holding on with a look of concern on his face. And in a sense, I like to think about this as this is what we do in the helping professions and those who support us in the helping professions. We're trying to be that steady support there and make a difference. Okay, so what can we do about all this? We'll give you the solution. Well, actually, not really. I'm going to give you principles of solutions because there's no one magic thing that's going to fix everything, pandemic or not. So here's the way I think about it. Things we should be looking for in solutions. We need to build capabilities. How do we build capabilities in families to do the things, right? Family says, I'm not sure how to read to my squirmy toddler. He doesn't seem to like it. Great, we can do that. We can share some tips, do some reinforcement, modeling, coaching, no problem. We need to build capacity. Parent might say to me, I love reading to my kids. I enjoy it. I think I'm good at it. I can't do it because I don't get paid a living wage and I have to work my second job at night, so I'm not home to read. Okay, well, how about we do something about a living wage so that you can actually do the things you know and want to do? We need to do things that are based in homes and communities, address root causes, have long-term effects, use a prevention mindset, leverage those key first 1,000 days of life, use things that are evidence-guided. You notice I didn't say evidence-based. I gotta tell you, when funders asked only for strictly evidence-based things, well, guess what? In pediatrics, you're probably gonna do the same 12 things over and over. We don't have a vast evidence base. We have a decent one, but it could be a lot better. And we need to also allow for innovation and the freedom to try that innovation. So please don't do something completely nuts, but use the evidence to guide you, but don't let it be a strict criterion in every single circumstance. And then the biggest key, how do we do things we can take to scale? Gosh, we have so many amazing programs that work well and have great outcomes, and a small handful of people get it because they're too expensive, the grant runs out, and then we've not figured out how we take it to scale. We still need those programs, mind you. I'm not arguing against that. We need a lot more of them. But we also need to be thinking about lighter touch, scalable things that work in concert because there's too much need out there. So we need to be thinking about all different levels of these things. So one example that I will give you is a program I've been associated with, Reach Out and Read. I'm the medical director of Reach Out and Read, Wisconsin. I also happen to be vice chair of the National Board of Directors, so I'm just giving you that full statement there. Reach Out and Read has been around for 30 years. One of my earliest brushes with it was in its early days when it was down the hall from that little closet at Boston City Hospital where I was coding those face-to-face videotapes that I shared with you earlier. Reach Out and Read uses the regular checkup, the Well Child Checkup as a platform to talk to families about shared book reading, doing that modeling, that coaching, that supporting all the things that I've talked about here. If I had to sum it up in a single image, it would be this item here, the prescription to read. I actually literally hand these out in clinic. And you notice it doesn't say read books because that used to say that, and I changed it years ago. I said, wait a minute, it's not really about the reading alone. It's about sharing books and doing it together, right? And it's really sending this message that this may be the most important prescription I ever hand a family because of all the things I've talked about brain development and relationships and stimulation and all that, right? So it really does make a key difference there. And really, this is an example of a good parenting, coaching, supportive model that's out there. And I like to think of programs like Reach Out and Read itself as being like the story of the blind men feeling the elephant, and they're all feeling different parts of the elephant and describing it in different ways. That, you know, Reach Out and Read and programs like it are the elephant. Because people say, oh, you're giving away books, because we walk in with a book in our hand and we hand it directly to the child and we watch what they do with it, right? So great, they're getting a book. Well, wonderful, but a book giveaway they're a dime a dozen. There's a million of them out there. the evidence base for book giveaways on their own is not particularly great. They're fine, but do they really actually make a big difference? Not great evidence on that. So yeah, it's a book giveaway, but we're also doing an educational intervention. We're doing developmental surveillance. Hey, I've given that book to that child. What are they doing with it? The child who flips open jumps off the table, runs over to me, grabs the book, starts flipping through it and says, oh, you give him as a cookie. Oh, I love this book. Oh, wow. I've seen gross motor skills, fine motor skills, language, social development, all these things. And it took me about 6 seconds. So really, it makes my job a lot easier. It's more useful than my stethoscope, pretty quite honestly. It helps build a parental capacity, right? How often do you have a chance to share books together? Oh, really? Oh, so your toddler's squirmy. You know, that is completely developmentally normal for a toddler to not sit still for an entire story. Yeah, you're doing it right. Why don't you talk about the pictures and ask him to help you find things, right? That might engage him more. When he's a little older, he'll sit still for the story. Yeah, you're doing it right. There you go. We've built their capacity to do that. We're helping buffer toxic stress, that togetherness, that time spent together doing that parent-child activity. We're assessing the health of relationships. Oh, when I give a toddler a book and they study it for a moment, and then they walk over to their parents and they hold it out in that read to me gesture. Oh my goodness, they have just told me the world, haven't they? They're saying, I know what this thing is. This is that thing that if I walk over and I hold it out to you, I think there's a good chance you're gonna pick me up, put me in your lap. We're gonna open this thing and we're gonna do this thing together, we call reading, and I want you to do it. Isn't that a wonderful assessment of the strength of those relationships? It just says so much to us. It's a public health approach, of course, and it's a scalable, evidence-based in this case, model. And of course, programs that do all these different things like ROAR, it's not any one of these things. Ultimately, of course, it's all of these things kind of jumping together, and it really makes my short time in exam rooms much more valuable in so many ways. And this is also what we train our providers, is to not just give a book and move on, to really stop, notice, observe, do all these things, and ultimately do the job that we went into this field for. If you want to hear more about all these things, by the way, there's a report called The Elephant in the Clinic. Just type that into Google, it'll pop right up. It's a free download, and it spends more time discussing all of these things. And if you're not already sick of hearing my voice, we do, as of this year, have a new podcast called the Reach Out and Read podcast. Just type it into Google or go right to that URL. We're 10, 11 episodes in. The latest one dropped yesterday. I'm the host. And we get to explore all sorts of things around not just books and reading, but also parenting, pediatrics, health and well-being of children and families. It's been real fun, so tell your friends. There's other ways in which we can make a difference. So, you know, again, I pointed out that ROAR is not just merely advice or a book giveaway, but we're doing parental skill building and support, right? That we're secretly a parenting support program, and we're using a network that already exists, right? We're not paying the docs to do this. I tell people that if you buy us some of the books, we'll throw the doctors in for free. You know, there's also some training costs, but whatever. I'm proud to say that in Wisconsin, PDG in its first year did support Reach Out and Read, and we're grateful for it because it's enabled us to make a difference in the lives of so many children and their families already for the 260 clinics in our state that do that, which is, we're touching the lives with a staff of with 3, we're touching the lives of 1 in 3 children under age 5 in the state, which tells you we still have a lot more kids to go. I also want to just show a shout out to another PDG venture separate from Reach Out and Read that I'm involved with here in Wisconsin, which is Child Care Health Consultation. It came out of an observation that I made in both primary care and in urgent care settings of how many families were bringing children in for evaluation, not because the families themselves were so concerned about their child's health, but because they needed some sort of clearance, letter, whatever, in order for their child to return to their early childhood setting. Now, I could sit there and grouse and say, those silly childcare centers, which wouldn't be fair. It'd be absolutely inappropriate. And by the way, I'm on the end of my term, very long term, on the board of our state NACI affiliate, so I totally understand the early childhood world as well from that perspective. But I realized that we in healthcare are not so great about providing advice and consultation about health matters around early childhood. I said, you know, this is actually a perfectly appropriate way to do what a handful of other states have done, is to create a health consultation system and to make sure that, again, just like we talked about with parenting, that our early childhood centers feel confident and capable when they set up their health policies, when they ask parents to have their child evaluated, or when they're administering medication or so on. So we are on the tail end of our first year on that, our needs assessment, which has gone really well. I've had some great students that have been working with me on that. We're actually doing a pair of trainings with the regulators at and licensors at the Department of Children and Families in Wisconsin. The first one was earlier this week, and the second part is next week. So we're really enjoying that work and finding it very meaningful, and hoping that we're able to continue that and actually build out a consultation system to support our beleaguered early childhood world in at least one critical way. You know, there's a lot of work around infant mental health, pyramid model, all that. Absolutely important, wonderful. But there's also all these aspects of physical, traditional medical health that are also not being addressed, that we'd like to make sure that we can, again, bring this new and better element of quality back. So here we go. 2 examples of PDG that have really made a big difference in that space, and that really have been transformational, and that I'm deeply grateful for. So come on, you know, much like the ads for the Hair Club for Men, right? I'm not just here to talk to you about it, I'm also a customer. So thank you. And this was a dizzying diagram that we put together as part of that consultation work, just to show how complex the world is, excuse me, around health. All the different interactions that go on between, you know, guidelines, policies, medical homes, parents, consultants, you know, and so on. Because when you start digging, you start to realize it's not a simple question of you know, let's put on a couple of webinars and that'll handle it all. That there's a lot of different places to go. So I would argue that we need a solution for now, and to a certain extent those solutions are there. We just need to know more clearly, like, they're there, we need to identify them as such. Families need support, right? We've talked about that over and over and over again, and it's so clear in this setting. And I would argue that relational health is where the biggest bang for our buck is. How do we support strong, nurturing, supportive relationships being successful? Because we know we'll see great long-term work for this, long-term outcomes for this. If you look at families that were affected and displaced severely by Hurricane Katrina, when you look 10 years out, who were the kids who did best? It was the ones where the families stayed together and supported each other, irrespective of the other circumstances, right? Relationships mattered and made a key difference. So that's where we can make a difference, is in relational health, over and over and over. And how are we making sure that those are being supported? And of course, making sure that the basic needs are met, like food and housing and safety and security and so on. And I would argue that things like shared reading, this interaction, makes a wonderful scaffold to be able to put that advice that we know the science supports into place. It's not the only thing, of course. You know, if you're hungry, the reading is not going to matter if you're chronically hungry. So yes, fix the hunger, but let's then also think about how we do this and how we make sure, whether it's parents hearing this directly, whether it's through their early childhood provider, through their home visitor, through wherever they're getting the message, how do we help that and not have it just merely be about pushing information at people, but also around supporting, scaffolding, coaching, modeling, and reinforcing. And if you can please let me indulge me with 2 more paintings from the Renaissance, going back to talking about Dante and Virgil, because there is great opportunity in this really, really wrenching time that we're in. What new things can we see? Here is Virgil and Dante meeting the great poets and authors of history. We've found things out. My goodness, we're doing telemedicine in ways that people never thought were possible. I got to say, actually, in my own system, I said something about telehealth 2 years ago, and I just got looks like, how can you even think that's feasible? Hey, guess what? We've been doing it. We've been doing it. Some evidence-based home visiting programs, like Parents as Teachers, has actually already had a pilot of virtual home visiting going and quickly scaled it when the pandemic hit. So there's all sorts of different elements and pieces and and other opportunities that are really coming in there that make a big difference. And then this painting really just strikes me. This is by Doré. Again, they're in the lowest circle of hell, Dante and Virgil. And you notice, look at the look on Virgil's face of just sadness. He's almost numb by all the suffering he's seeing around him. And I think, again, we've all kind of felt that way at some point. Like how can things be so disrupted and so different? But there's something really important here. You notice that this time it's Dante who has his arm around Virgil. He's the support. And I would argue that to some extent, I hope, and I think we do if we look for it, we all derive support and strength from those that we serve, whether it's our patients, our clients, the people we're training in the field, the policies that, that we're writing that are making people able to do things, the budgetary supports, whatever role we play, right? That seeing the work that's happening around us so we can all get out of this pandemic is really critical and really important. And I hope we take solace in that ourselves, because we ourselves need to think about our own needs. And sometimes it's those that we quote unquote serve who will actually be giving us the support that we need. So to wrap this up, thinking about a public health approach to building healthy brains, we know that kids are going to fall sometimes, and we need a net to catch them. Okay, so you pull out your biggest net. This is your prevention net. This is a net that has big holes, but it's a big, big net. It's going to catch many of those kids. Great. Well, there's some holes. Kids are going to fall through. So for that smaller number of kids that falls through, you haul out your second net. This is your screening net, your targeted interventions net. It's a smaller net, but it's got smaller holes. Still got some falling through? That's where you get out your treatment net. Okay, it's a small net. It's not very big. Hopefully has no holes. If you let everyone on top fall down to the treatment net, they're going to fall right off the edge. The system can't take it. But you can't rely on that top net to catch everyone. All levels of this are necessary. None on their own are sufficient. Okay, so this is not to pit these things against each other. It's to say we need an integrated system. And you can ask yourself in what you do, or the people you serve or work with, which net are they at? And they don't need to do all three, but make sure you know who's on the other nets. And for crying out loud, support each other, right? I'm doing this all the time in my work as president of the Wisconsin chapter of the AAP. Hey, that's not money coming to pediatrics, but it's really important. Can you please make sure you fund that? Okay, because that's going to make our lives easier indirectly. Yeah, so please give them the money. No, not us, them. We'll come to you when we need something, right? We need to be thinking about this as an integrated setup. When I started, I read aloud to you from the dot. I chose that book because it's a book fundamentally about relationships, right? It's about a relationships between a teacher and a student, right? Vashti was having a really bad day and she just wasn't having it. And you could see that story going wrong, right? Where the teacher says, young lady, you better have a better attitude, otherwise you'll be in the principal's office, right? That wouldn't have gone well. Instead, she says, you know what? Her need today is not to get this assignment done, and it's not that important. Let's just have her make a mark and see where it takes her, and then let's celebrate it. Right? And she took off from there. All the rest of that work was hers, her creativity. She was encouraged, it was celebrated, it was great. But there was something else that happened in that story. We don't know if it was intentional skill building because we're not inside that teacher's head, but she taught Vashti something, because what did she do at the end? She turned around and she supported someone else, right? The little boy who couldn't draw a straight line, right? And it shows you the promise that when we get it right, we're going to get it right for a lot more people that we may never directly contact, right? Because they're getting the benefits of it as well. We can do this also through public investment. Just again, PDG is public, right? The brain's capacity to change is greatest in the early years of life. Yet, the spending on programs to quote unquote change the brain is all later. It's in adolescents, adults, etc., right? We need to be changing that dynamic because the science tells us we get the best bang for our buck early on. I want to end with this quote here from the Sutton Trust. While schools can do much to raise achievement among children who initially lag behind their peers, all too often preschool gaps set and train a pattern of ever-increasing inequality during school years and beyond. Any drive to improve social mobility must begin with an effective strategy to nurture the fledgling talent in young children, so often lost before it has had a chance to flourish. And I always end with this photo. This is my wife reading to my son. I caught them years ago in a beautiful moment of being lost in a book together. It reminds me that parents are their child's first and best teachers, and that children are made readers in the laps of their parents. But that role as first and best teacher is something parents need to see themselves as, they need to feel comfortable about, they need to feel confident in that role. And if we can do things to help that happen fundamentally, we're going to see amazing things happen because of those strong relationships, those strong bonds, the strong supports that I've talked about today. And that ultimately is where we'll see the big payoff. So when we think about advice, when we think about programs, and we think about policies, that's where the real focus should be, is supporting those strong relationships. Here are my public-facing social media links for those of you who do Facebook and Twitter. I have yet to completely figure out Instagram, and I'm definitely not going on TikTok. And email address in case you have questions or something down the road. And I mentioned the podcast earlier, of course, if you just care to listen on any of that. So with that, it's been a delight to spend some time with you this afternoon. And I know that we will now be switching over to take your questions, which I hope that you have been busily putting into the chat box as we've been into the appropriate place as we've been going along there. So I'm going to flip my slides off here and turn it back over to Missy to lead the question section. Thank you.
Thank you, Dr. Navsaria. That was wonderful. We really appreciate you being here this afternoon. So we do have a handful of questions. I'm going to pick a couple that I think are relevant, and we'll try to get some of these answered for those we can't get to this afternoon. But the first question that came in is, how would you recommend states who are working to create mixed delivery systems connect to the healthcare system? Who might be some of the critical partners? Who might be missing?
Mm-hmm. I think one of the best places to connect with healthcare systems is probably a dual approach. One is to talk to the professional organizations that are involved. So if you're looking specifically at young children and families, I would go to Pediatrics and Family Medicine, right? Talk to your state chapters of American Academy of Pediatrics or American Academy of Family Practitioners, because they can help you understand the perspective of the frontline practitioner. And then the other place to go, of course, is to the systems themselves. And you notice I'm asking you to go to both, because the decision-making, the timing, the kind of who controls like patient flow and all that, that's the health systems. But who you actually need to do this and do it realistically are the healthcare providers. And believe it or not, they're sometimes not always aligned. So kind of doing a dual approach there and getting the buy-in from both sides is really important.
That's great. All right. The next question says, let's say, I love the presentation. It's validating to know what we know in our hearts, or it's validating to hear what we know in our hearts and try to do. What might your priority message be to those who are not in the choir when we need to talk to business leaders or government officials with different priorities who can help us support this work?
So, you know, the funny thing is with business, right, there's often this, look, this happens a lot, like groups like Ready Nation, who I'm on their speakers bureau, okay, so I'm not poking fun at them or anything, but, you know, there's often this, let's trot out some people from the business world to talk about the importance of early childhood. Let's trot out a retired military general. I mean, this happens a lot. And I think that's important, right? You need the unusual suspects to talk about these things. But I also think that we need to not focus solely on a dynamic of a short-term return on investment and say that, you know, there are some things that are not just, yes, is the long-term part, right? You know, high school graduation rates, you know, and long-term careers and so on. But let's also talk about how this is important for families right now. This pandemic has highlighted, right? I mean, how many times have we all been on a Zoom meeting and one of our coworkers has had, like, you know, a child running through the background, right? And I hope that has become acceptable and normal, right? Because we're all doing the best we can. So how do we highlight that? How do we actually say your workforce needs to have confidence that their child is in a safe, nurturing, enriching, flourishing, thriving place? That pays off for you in terms of people who will stay with your company, who will do work that you want done, that there's really big payoffs in all of that. And it's the sort of thing that I would hope anyone would want for their own child. And I think we need to push them to ask, why would they not want it for everyone's children?
That is great. Well, thank you so much, Dr. Navsaria. This is a great way to wrap up our meeting today. As we wrap up, I also want to thank all of you for participating this week. We hope that you learned something from your peers and from the experts who are part of this conversation. As Richard said at the beginning of the week, we also hope that you laughed a little and you had some fun. We all know we need a little bit of a break in our lives. This convening was planned in 3 months, and I would like to recognize a couple of the key groups that really helped to pull this off in such a short period of time. First, I'd like to recognize our core, Paula Bendel-Smith and Richard Gonzalez, for setting the direction and leadership for all their help. They did a fantastic job of turning things around very quickly to help us pull this together. I'd also like to thank all the PDG V5 TA Center team. You all did a fantastic job of planning the content and the work to actually make this come to life. And finally, we had a team of folks, both federal program officers and state representatives, that helped us create the agenda, which is really important for our success. Additionally, this is also the very first convening that we've had for many of us that has been virtual. So we could not have pulled this off without our tech team and our logistics support. So thank you all for your continued assistance. So as we learned about some of the innovations and the strategies that you're using this week, we know that there's more work to be done. We hope that the conversation doesn't stop here. We will be providing, if you already have access to MyPeers, you should already be able to get into the system, but there's gonna be a new group that started that actually has all the resources that we've been able to share this week, and we hope that's a space where you can continue to have the conversation. We know that we are working across many time zones, and that's a platform that allows us to continue the conversation as a collective group. That is something that we will provide. Additionally, in 2021, we will be able to support the continue to support all 50 states and territories, regardless of your grant status. We encourage you to reach out to your technical assistance specialist if you have a TA need, or if you'd like to get together and learn a little bit more from one of the peers that you learned about this week. And finally, as we look ahead and plan for another convening in 2021, please do complete the survey that helps us to understand what you thought was helpful and valuable in the conversations and what you'd like to see more of next year. We hope that you are having a wonderful weekend, and thank you all so much for being here today. Have a good weekend.